A health tip brought to you by Professional Orthopedic Associates.
Hi, my name is Dr. Craig Foose. I'm a board-certified, fellowship-trained orthopedic surgeon practicing in sports medicine. I'm here to briefly talk to you about meniscal tears of the knee. The meniscus is a very commonly injured structure inside the knee, oftentimes leading to surgical treatment. The injuries that we typically see to the meniscus are very commonly seen in sports medicine, sports athletes, commonly occurring from a twisting injury to the knee. We do see older patients who develop degenerative tears of the meniscus as well. The common symptoms that go along with a meniscal tear of the knee are pain either on the inner or outer side of the knee. Oftentimes people feel catching or even swelling in the knee and difficulty bending the knee fully. Typically when we see a patient who has a meniscal tear in the knee, we'll see tenderness along one side of the knee versus the other and maybe a restricted range of motion or swelling. The meniscus itself is a flap of cartilage that works as a shock absorber inside the knee. And when the meniscus tears, it creates a flap that catches inside the knee joint when the knee bends back and forth, which oftentimes leads to irritation and sometimes swelling in the knee. Although there are times when the meniscus sits down in place and doesn't cause pain, very commonly the pain occurs with twisting, turning, bending activities, particularly in sports. Treatment oftentimes goes along with diagnosing it. The diagnosis is often made with an MRI along with clinical examination. The problem with meniscal tears are that flaps of cartilage inside the knee joint don't have a good blood supply to them. So whereas if you cut your skin and you bleed, it brings in cells that create healing of the meniscus, this typically does not happen in this part of the knee. So the meniscus has a very poor ability to heal on its own. Oftentimes this creates a piece catching inside the knee joint that needs to be removed. The treatment for it commonly comes down to an arthroscopic surgery on the knee, which is a small surgery where we make two small incisions, place a camera inside the knee joint, and take the small torn piece of cartilage out or repair it depending on the type of tear that there is. This is commonly associated with a short course of rehabilitation afterwards, and many athletes can get back to their normal activities within the course of a month or 6 weeks following the surgery. This is just a brief synopsis on meniscal tears of the knee, and further information can be obtained by seeing a physician for the treatment of this type of problem. Thank you very much.
This has been a health tip brought to you by Professional Orthopedic Associates.